Hello, everyone. Welcome to my first ever progress report. I will be talking about psychodermatological interventions in chronic skin disease. So my name is Genevieve Arany-Lao. I'm a first-year PhD student and fifth-year medical student here at Semmelweis University. My supervisors are Norbert Kish and András Bánvölgyi. And my vision through my research is to be able to decrease the psychological burden in those who have atopic dermatitis. And in order to do this, I would like to achieve the implementation of psychotherapy in the standard care of treatment for this disease. So I have two ongoing projects currently. The first one is going to be a systematic review and meta-analysis, which began in September. And the second one is going to be investigating an international survey, which started in November. I will be talking about my first project first. It's about investigating the efficacy of psychotherapy in the treatment of patients with atopic dermatitis. So, atopic dermatitis is a chronic inflammatory skin disease. It affects about 10% of adults worldwide, as well as 20% of children. Its key features are intense pruritus or itching, as well as scaling, formation of papules, inflammation, and because it's a chronic disease, it can lead to the thickening of skin in the form of lichenification. The standard care of treatment currently for this disease is the use of moisturizers, the use of immunosuppressants, biologics, as well as topical corticosteroids. However, psychotherapy is being looked at as a novel intervention for this disease because of the strong psychosomatic factor in this disease. So atopic dermatitis actually can be precipitated and exacerbated by emotional stress, and up to 70% of patients who are diagnosed with their first onset of the disease had some kind of psychological or emotional stress prior to the onset. So the aim of this study is to define the role of psychotherapy in the treatment of atopic dermatitis. So the clinical question is whether psychotherapy is effective in the treatment of the disease, and we're using the PICO framework to investigate this. So the patients are those with atopic dermatitis. The intervention is psychotherapy alone or as add-on to standard care of treatment, and so the comparator is the standard care of treatment. And the outcome is going to be measured in disease activity. So we hypothesize that add-on psychotherapy is actually going to be superior to just standard care of treatment alone. And the clinical implication of this is going to be decreased improved quality of life in the patients due to decreased disease activity by psychotherapy. So as you can see, the search key is this. The first domain is the disease. Second domain is the psychotherapeutical methods that we are including in the study. There are 3 databases that were used to conduct this search, and the results for each can be seen. I would like to highlight a few articles, key articles that I found during the search. So these are all randomized controlled trials, and their outcome is measured in the same disease score, as well as their comparator is the same, standard of care. And the population is also the same, patients with atopic dermatitis. The only difference is the type of psychotherapy that were used as an intervention. So currently, we are at the, so we started with 7,000 articles prior to the duplicate removal. And right now we have about 5,500 articles, and we are at the title abstract selection, hopefully finishing soon. So now I would like to move on to my second project. So before I do that, I would like to highlight that in the first project, we are focusing on randomized controlled clinical trials, which have a high degree of evidence. However, their limitation is that they are have a very high exclusion exclusion criteria, inclusion criteria, as well as the generalizability is very low. Therefore, in an international survey, we will be able to investigate the clinical setting of the clinical practice of actual psychological interventions. So again, there are 223 million people globally living with atopic dermatitis, so it affects a big portion of the globe. And actually, 30% of the dermatological diseases are seen in the clinical setting is atopic dermatitis. Here it says eczema dermatitis, but it's the same thing. And so it's not surprising that the #1 burden of disease in all skin disorders is actually held by, the #1 spot is held by atopic dermatitis. And so this burden actually also impacts the psychological aspect. So the psychological impact of atopic dermatitis is very high. Actually, one study showed that there are higher rates of depression as well as anxiety in those who have atopic dermatitis. Therefore, psychotherapy could be used effectively in the treatment of the disease. So using this international survey setting, and we plan to conduct questionnaires both to patients as well as physicians in order to answer these 3 key questions: whether patients have undergone psychotherapy in the past, the exact type and duration of psychotherapy that they received, as well as whether the skin symptoms showed improvement upon the received psychotherapy. So the aim is to assess the efficacy of psychotherapy in atopic dermatitis. The clinical question is psychotherapy effective as an add-on treatment? And we're using the PEO framework. Patients are those with atopic dermatitis, and the exposure is psychotherapy. And the outcome here is going to be measured in change of disease activity as well as the quality of life. So the hypothesis is that psychotherapy decreases disease activity and therefore improves the quality of life in patients. So the clinical implication will be that psychotherapy should be used as a part of the treatment for atopic dermatitis. So in summary, I have 2 ongoing projects, both in the topic of atopic dermatitis, one investigating the efficacy and the other one investigating the clinical practice of psychotherapy. So I would like to finish with a quote from Theodore Roosevelt: "Believe you can, and you're halfway there." So thank you very much.
I would like to ask you if you know if there are any other cases in other dermatological diseases where psychotherapy is being used currently for the treatment. Thank you.
Thank you for your question. So there are actually, yes, there's especially for like other diseases like psoriasis and alopecia areata, there are studies currently ongoing looking at the effect of psychotherapy. There was one study that I found interesting. It was investigating the effect of psychotherapy on itch intensity or itch discomfort. And it included a variety of skin diseases that has itching as a symptom, such as atopic dermatitis, also psoriasis, and stuff like that. And so the results of this study actually showed that psychotherapy, which I think was behavioral therapy in that case, actually did improve itching. There was also another one that was just interesting. Music therapy was used in patients who had urticaria, and it showed that actually this music therapy decreased the production of IgE and thus improved those symptoms.
I'd like to ask, how will you compare different psychotherapeutic methods when they use different disease activity scores?
Thank you for your question. So there are, as I showed on the one of the slides, there are multiple disease scores, such as the POEM score and the SCORAD score, measuring the disease activity of atopic dermatitis. And so we will use the standardized mean difference in order to standardize the all the scores into one scale, so that we can compare the actual effect of each study.
How many sessions of psychotherapy did the patients get, and for how long?
Well, actually, each type of clinical trial that I'm including has different lengths, even for the same type of therapy. Some are just a few weeks, like 5 weeks, and some are 1 year. So it's very varying, actually.
Have you encountered any study that has a long-term follow-up after psychotherapy? There's a few studies that have like 1 year follow-up, basically, but that's the longest one I've seen, probably.